take care of the lower parts. So based on that, it treat diarrhea, all kinds of diarrhea, right? All kinds of excessive pattern and the differential pattern, and also constipation, right? Diarrhea, constipation, that's the main disorder of large intestine. Secondly, it helps to deal with this, the edema, drum distension, swelling of the face, turbidity, painful urinary dysfunction. They deal with this, right? Regulate spleen stomach, resolve dampness and damp heat. Okay, help to regulate the water passageway. Yeah, not a main point for this purpose, but it can help. It can help. So above it, that's Renan. Renan is a stronger one to deal with water, okay, compared to stomach 25. But stomach 25 can help. For vomit, retching, difficult digestion, poor appetite, sudden thermal disorder. Since it can regulate spleen and the stomach, right? Harmonize spleen stomach. It helps to deal with that as well. So that's why sometimes we combine Ren 12 and stomach 25, combine these 2 points together to deal with digestion problems, especially when those digestion problems cause constipation or diarrhea. Okay, so we combine stomach 25 and Ren 12 together. Yeah. Abdominal pain, abdominal distension with labored breathing, intestinal abscess, generalized swelling with severe cutting, umbilical pain, umbilical shunt disorder. Shunt disorder is herniation, right? Herniation of the intestine with localized pain that periodically surges up to the heart. Shunt disorder, running peachy. It takes care of all of this area around the umbilical the situation. Yeah, it can soothe the qi. Okay. Especially I marked here, sometimes you may ignore that or forget that. It also treats abdominal mass in women, right? Uterine problem, pain of the uterus, dysmenorrhea, irregular menstruation, infertility, right? Red and white leukorrhea. Yeah. So that's why, sometimes we treat menorrhea, we treat tumors in utero, we choose stomach 25. Don't be surprised, okay? Because it's a good one for this regulate qi and blood, right? Elements stagnation in this lower abdomen. Yeah, so later we will study stomach 29, right? Stomach 29, that's an essential point to deal with this. Stomach 25 can help. Cold shivering from malaria, severe heat with manic raving. Yeah, so stomach 25, to some extent, it can clear heat. It helps to, a lot of excessive pattern, right? Like dampness retention, water retention in the lower jaw, qi stagnation in the lower jaw, harmonize stomach spleen, and to treat the blood stasis in the uterus, right? Or some tumor in the large intestine. So those are all turned to excessive pattern. And except for that, any diarrhea, constipation, if it's differential pattern, yes, it's also helpful, also can do that. So stomach 25 is quite likely like cure, DUAL, right? Dual function, right? So mainly about reduce some excessive pathogens and also can tonify some deficiency. Yeah. So those are maybe included that. Yeah. So let's look at the commentary here. Stomach 25 is a frontal point of large intestine located on stomach channel, right? So, and that's the point where the qi of large intestine gathered and concentrate on the anterior surface of the body. Okay. So the second point is the 2 principal actions of stomach 25 are first, treating intestinal disorders. Yeah, typically diarrhea and constipation. And 2, regulate qi and eliminating stasis in the lower abdomen, right? So that's why I deal with some uterine problems. So stomach 25 is a single most important point for the treatment of the widest variety of intestinal disorders. Yeah, so just now, you mentioned the IBS, right? IBS is a perfect application for this point. Due to its ability to regulate spleen and transform dampness, it's 40 areas in the treatment of diarrhea. Okay, so diarrhea and dysenteric disorders, no matter it's acute or chronic. So stomach 21 is the first choice. Always is the most important point. Okay. Stomach 25 should form a pivotal role in the prescription in combined with other suitable points selected according to differentiation. It's talking about what? Diarrhea and dysenteric disorder, right? So those situations, stomach 25 should be the pivotal point in the prescription. And based on different patterns, you choose other points with it, right? Such as if there's a heat, damp heat, right? Damp heat causes the diarrhea or dysenteric. Yeah. So there is a fever. you probably will combine with large intestine 11, right? Yeah. If the differentiation pattern, yeah, combine with what? Like stomach 36, 25 that, Ren 12, yeah, 25 that, yeah. So in modern practice, stomach 25 is much used in the treatment of bacillary dysentery and acute simple appendicitis in combination with such point as lower Hersey point, right? Stomach 37 and LI11. Why LI11? So we see this kind of those inflammations, right? Inflammations usually accompanied by heat, by fever. So that's why we choose those two together. So stomach 25 as a front move point combined with a lower Hersey point of large intestine, which is stomach 37. That's a classic combination, okay, to deal with all conditions of intestine, large intestine. Yeah, so they always go together, front move point and the stomach 25 and the stomach 37. Yeah. As talking about constipation, yeah. So many authorities consider the more lateral spleen 15 be more effective. I would suggest if you treat constipation, use both, right? Choose both spleen 15 plus stomach 25. Choose both. So yeah, I do study that said spleen 15 is a necessary one for constipation. It's probably to some extent it's more effective than stomach 25. Okay, so for diarrhea, stomach 25 is first choice. Constipation, use it combined with spleen 15. Yeah. So another function of stomach 25 is dampness draining, right? Dampness draining. That's why it's used for the like edema and drum distension. Drum distension is due to what? Liver issue, right? Liver problem. Then there's accumulation of abdominal water. Yeah. And the turbid, painful urinary dysfunction, retention of the urine. Yeah, it's helpful. Is it good for uterine fiber? Yes, it's good. It's as an assistant point. Um, what about bowel obstruction? Are you talking about like constipation?
Yeah, this is like when it gets beyond constipation and now there's an actual obstruction in the bowel. Like, could we do this technique to prevent that from happening? Like, if it's severe constipation?
Yeah,
because constipation will back up right into the system. So if somebody's constipated enough, it's going to obstruct their bowel. So could we use this technique to prevent an obstruction from happening in the future?
Yes. Yeah. The answer is yes. Yeah. So use those points. Spleen 15 plus 25 is always helpful, to propel this, bowel movement. Yeah, to help to remove this waste in the large intestine. Yeah. Why not? Right? Yeah.
Thank you.
No problem. Yeah. Sometimes it's hard to, corresponding the specific Western medicine disorders with syndrome of TCM. But I think the TCM usually they look a bigger picture, right? A bigger picture. So compare the Western medicine compared to Western medicine. So like when we see constipation in TCM term, that's kind of talking about like bowel obstruction, difficult to discharge, those kind of problems. Yeah, it's covered apart. So the effect of stomach 25 extends upwards to the stomach, is indicated for vomit, retching, and sudden turmoil disorder in which vomiting is accompanied by diarrhea. Yeah, we know that 天枢, from its name here, right? Heaven's pivot. So why it's located in the abdomen, but named as heaven's pivot? So probably because it can connect the stomach and the lower jaw, right? Middle jaw, lower jaw. Yeah. It's a key point to connect it, the whole digestion tract. Okay, the whole digestion tract. So Warrior's classics also emphasize the ability of stomach 25 to 25 deficiency. Yeah, so this book said recommending it for lower yuan deficiency and cold. If you do abdominal acupuncture, this is another scale, right? If you the abdominal region as a microsystem. Okay, so just distribute needle in the abdomen area. Okay, then treat the whole body's issue. So abdomen acupuncture, they apply stomach 25 as a 25 point. Said stomach 25 combine Ren 12 and lower Ren 4. So that is a group 25 original qi. 25 original qi. So the must be from here, right? So you just remember stomach 25, majority of time it's busy, right? It's busy point to deal with some excessive pattern, but it does also deal with some differential pattern as well. Compared to Ren 4, Ren 6, it's not a perfect one to tonify deficiency, but it definitely can deal with deficiency pattern. Okay, deficiency pattern causes diarrhea and bowel movement. I'm talking about body acupuncture right now, not abdominal acupuncture. Okay, so that's corresponding to characteristic of front move point, right? Front move point, some acute, some full organs issue, some excessive full organs issue. Yeah, back shoe point is more likely 25 qi, 25 yang. So stomach 25 also has an important action on regulating qi element stagnation in the lower abdomen. Yeah, so it's for a wide range of problems, including distension pain of the abdomen, intestinal abscess, Shan disorder, menstrual disorder, even uterine tumor, those fibrosis, yeah, tumor, yeah, those stuff. So this point is kind of like, we will say it's a connecting point, right? Connecting point. So upward, it connects stomach spleen. Lower, it's connected with lower abdomen, large intestine, and uterus. Yeah. 4, yeah, market most one. It's a good one. Yeah, commonly used. Okay, so next one, number 26. We'll say no sir. Yeah, not so commonly used probably. Yeah, so number 25 is so good, right? It's covered it, shadowed it maybe. Yeah. So this one is 1 cun inferior to umbilical and 2 cun lateral to the middle line. So basically it's 1 cun under stomach 25, right? So perpendicularly insert 1 to 1.5 cun, same as stomach 25. It can regulate qi, elevates pain, yeah, to treat severe abdominal pain, abdominal distension, herniation, right? Herniation. And because it can regulate qi, elevates pain, right? Lower abdomen, right? Except for large intestine issue, then there is uterine bladder issues, right? Uterine bladder issues. So it helps to dysmenorrhea, right? Amenorrhea. Severe abdominal pain, especially lower abdomen. Sometimes we combine these points together. Okay, stomach 26 and stomach 25. Then what we got another one, 1 cun below stomach 26. That's 大巨穴, right? 大巨, stomach 27. It's actually at the same level as Ren 5, but 2 cun beside it. Okay, 大巨.
Young men.
Stomach. 大巨, yeah, probably no star. No star.
Young men, stomach 21. Young men, stomach 21.
Okay, so 大巨穴, this one. Yeah, like stomach 25, penetrate perpendicularly insert, right? 1 to 1.5 cun, and be careful, don't do too deep and penetrating peritoneal cavity. So the action of this point benefit kidney and firms essence, and regulate qi, promote urination, right? So it's getting lower and lower and near to bladder region, right? Bladder region. So it help to promote urination and benefit the kidney and the firm essence. So also, we don't choose it too often to tonify kidney, right? So we choose kidney 12, right, more often. So therapeutic acupuncture, we just studied. The kidney qi difference, kidney yang difference, kidney essence difference. We choose local points like kidney 12, right? 大和, kidney 12 to 25, benefit kidney and firm essence. We didn't choose this one, right? We didn't choose this one. So its indication is premature. Yeah, so any problem related to kidney qi deficiency, kidney essence deficiency, right? So some reproductive system issue include, urine problem, right? Difficulty urination, retention of urine. This one close to REN 3, right? REN 3. REN 4, yeah, it has some similar function. Yeah, since it can benefit kidney and firm essence, so fright is an emotion of kidney, right? So if kidney has enough qi and essence, it can, to overcome this fright, I can manage this fright emotion. It's also helpful for lower abdomen distension and fullness, Shan disorder. Yeah, maybe the several points in the stomach channel, this is the only one can benefit kidney and firm the essence. Okay, next one, stomach 28. Stomach 28, this is a water point we studied, right? Water point. So which means it's one of the essential points to deal with edema and urine retention, right? Urine retention. So you can mark it as 2 star. Yeah, it deserves 2 star at least.
Young men.
In the Excel that said 1 star, I would like to put it at 2 star, okay? Yeah, Excel, that's 1 star. You can add another star to it. Stomach 28.
Young men.
So this one, it's right beside run 4, 3 trun inferior to the umbilicus. Okay, right beside run 4, 2 trun. Run 4 is a key point, right, in the run channel. And run 4, 25 kidney, right, 25 kidney. However, stomach 28 don't have any function to nourish to 25. Usually, it deals with the water and it's soothes the water passageway and let the edema go. Okay, let the edema go. It's also help regulate the function of bladder, urinary bladder. So perpendicularly insertion 1 to 1.5 trun. Okay, so the caution here: deep insertion may penetrating the peritoneal cavity in thin patient or may penetrating a full bladder. Okay, from here, when you needle the points below it, you need to ask patient to go to bathroom, okay, before needling. They go to bathroom to empty the bladder before needling. Okay, remember this from the stomach 28 and the below 8. So it's pretty close to urinary bladder. If the patient have a full bladder, it's easy to penetrate it. Okay, so remember this. Ask the patient, go to bathroom and empty their bladder before you needle, stomach 28. The action of this point is regulate lower jaw, dispel stagnation. Okay, so this stagnation usually that's talking about water retention, dampness retention, caused chi stagnation, and the benefits of bladder and the uterus. See, retention of urine and feces, right? Edema, cold in the bladder. Yeah, distension, the fullness of the lower abdomen, shunt disorder. Hypogastric pain in woman, extension to genital, dysmenorrhea, infertility, cold in the uterus. Yeah. Even lumbar pain accompanied by accompanying the menstruation, right? Menstruation. So this one is a good one to move qi and move qi. So if there's a qi stagnation, it causes water retention as well, and also all kinds of pain in that area, right? The pain of the lumbar vertebrae, pain of the shoulder and the back. So this one, some points located in the lower abdomen, they can treat lower back pain. So such as run 4, such as stomach 28. So consider about the back, right? The right back, that's lower back, lumbigal, right? So that we can say, oh, that can be a local point. So when you use this action here, so when a patient have menstrual problem combined with lower back pain, this is a perfect choice, right? Perfect choice. Yeah, you can also choose stomach 29, right? Stomach 29. Yeah. Or combine these two together, stomach 28, stomach 29. Okay. Another situation is the patient can't do, or you just do the one side treatment for lower back pain. One side treatment for lower back pain. Usually we choose back treatment, right, for lower back pain. But if the patient, they don't want to show you their lower back, they just can lie down with their back. So treat lumbar vertebrae B syndrome, you can choose this point, right, from the front. But melee, this is a water point, right? This is a water point straight down. Yeah. So this point have dual actions of clearing stasis from bladder and promote urination on the one hand, and clear stasis of qi and blood from the uterus on the other. So this could be like two main function of this point. I would say since its neighbor, stomach 29, have a stronger effect on clearing stasis of qi and blood from the uterus. So traditionally, stomach 28, we think it's more focused on the first action, which is clearing stasis from bladder and promote urination. Okay, so stomach 28 is more focused on this, and stomach 29 can take care of the other side. As far as the formal action is concerned, stomach 28 is indicated when excess pathogenic factors obstruct the qi transformation function of the bladder, leading to retention of urine, right? From here, we say, oh, compared to its neighbor, run 4, stomach 28 seems like deal with some excessive pattern. Yeah, yes, to this point, usually we don't use it for 25 kidney or bladder, no. The unifying factor between these two sphere of action is obstruction, right? Obstruction. So this one can deal with this obstruction. This point is almost exclusively used for excess pattern. Stomach 28 is also indicated for pain of the lumbar region and pain of the shoulder and back, and appears in at least a classical combination for this purpose. Yeah, see here, right? See here, the combination here. Stiffness of the spine, stomach 28 and 筋缩 and do 8. And otherwise, pain of the shoulder and back, stomach 28, stomach SJ 16. SJ 16 is 天右, right? Near to shoulder. Stomach 12, right? Do 11, and 大柱 BL 11, and 10 2, 人 22, and LI 16. Okay. Then we have stomach 29. Why? It's hard to say. Yeah. If consider about the meridian, stomach meridian, right? Stomach meridian from a head face and it goes down, goes through chest, and I just say because it's located in the Yang-Ming channel. Yeah, Yang-Ming channel is good for NAB syndrome. Maybe that's one of the factors we can consider. Definitely, it's not an essential point to treat lumbar vertebrae or shoulder and back pain. You don't have to use it. It's not a necessary one. Yeah, so it just have this function. It showed up in some classic book. That's all. Yeah. Its relationship with large intestine meridian. Yeah, maybe. Yeah, it's a very weak link. Very weak. Consider the shoulder and back pain. Yeah. Stomach 29. Okay, so this deserve a 2-star. Okay, deserve a 2-star. 归来穴, right? 归来穴. We use it a lot in women's disorder gynecology, especially when there's irregular menstruation. Yeah, so this is almost essential local point for women's disorders. So it's 4 tun inferior to the umbilicus level with Ren3. Same caution. Okay, so perpendicular insertion 1 to 1.5 tun. Be careful, don't penetrate in a full bladder. Okay, ask patients to go to the bathroom first when you needle it, before you needle it. So the actions is warm the lower GL, regulate menstruation, and benefits the genital region, right? Yeah, so it's why we need to warm the lower GL. There's some explanation here. Okay, so this is on probably, I would say majority of points located in this area, they can clear heat. Okay, such as stomach 25, it can clear damp heat, right? So stomach 28, it's deal with some cold or heat pattern. This one specifically, it can warm the lower GL. Okay, stomach 29. Irregular menstruation benefits the genital region. It deals with amenorrhea, irregular menstruation, especially when it's due to cold. Okay, the cold can a lot of gynecology issue actually related to cold, the pathogen of cold. Why we see uterus as an organ, right? Uterus. So it's naturally likes warmth because there's abundant vessels distributed in the uterus. So the circulation of blood, right? They need the energy, right? So warmth actually help to circulation of the blood. But cold can congeal or coagulate the blood, right? So it's not a good way for uterus. That's why infertilities and some menstruation issue. The herbs formula, right? They started from like warm the lower GL. Of course, some pattern that belongs to damp heat, right? Damp heat also can cause menstrual problem, also can cause infertility. Cold is not the only one. Yeah. But I would say cold is an important passage to cause the uterine problems.
Dr. Yan,
Yeah.
quick question. If the uterus is too warm, could that cause miscarriage?
Yes.
Like if it's too cold or too warm,
Yes.
it could do either, right? Okay.
Yes, too cold or too warm. Both of them can cause miscarriage. Both of them can cause menstruation issue. Yes.
So if we had a patient who was having numerous miscarriages, could we apply this to try to balance out their system? No.
This point helpful, but you have to identify that's cold pattern or heat pattern.
Right.
You have to combine the other points, right?
Yeah.
Yeah.
So, like a combination of other points.
Yeah.
But this point be one of the points used in correlation with other points to help with
exactly.
The okay.
Definitely. Yeah. Yes.
Okay. And that could go with if they were infertile as well, right? Like
yes, menstruation as well. Yeah,
perfect.
Menstruation as well. Even it can warm the lower GL. It doesn't mean it can't used for some warm pattern, the heat pattern.
Right.
Yeah, it can do that, but have to combine with the other points. Yeah, which can clear heat effectively, right? Yeah.
Right. Okay. Thank you.
No problem. That's good. You guys have like TCM thinking, right now. You just you're doing that. You cultivate the methodology, right? Methodology. TCM is like standard higher position, a larger position, a larger picture, say the larger picture. And always consider about the whole body situation, different patterns. You always can choose different, combination, right, to deal with that. But technically, this point is good for women's, any types of women's issue. Yeah. Say infertility, like pain and cold of vagina, especially. Yeah, leukorrhea. Yeah. Retraction of the testicles. Retraction usually meaning there's cold. Cold causes shrunk retraction. Pain of penis for men, right? For men. Yeah. So impotence, seminal emission. Yeah, I just missed the men part. Okay, for men, of course, it's also useful. So this is mainly for genital area and reproductive system and so. Okay, 729. It's named as 归来, right? 归来 in Chinese meaning return, right? Return. So that make it easier to remember. Okay, so its ability is to restore the condition of uterus and genital to normal. Yeah. So the overriding action of stomach 29 is to warm the lower jaw, most particularly the uterus in women and the genital region in both men and women, right? So it's stress cold, but it doesn't mean heat is not a pathogen of women and men's issue. Of course, both sides. Stomach 29 is one of the primary points to warm the uterus and drive out pathogenic cold. Yeah, if it's cold pattern, yeah, definitely stomach 29. If it's a heat pattern, yeah, you need to some points to help it to clear heat. Stomach 29 is also an important point for treating disorders due to decline of kidney yang, which generate some empty cold, right? Yeah. So stomach 29 is also indicated for running picture, which may arise when kidney yang differentiate leads to accumulation of cold in the lower jaw. So basically, if that's a situation, we choose stomach 30. Okay, stomach 30. This is stomach 29 as so another thing is you can for cold pattern, right? Cold, no matter it's deficiency cold or excessive cold, yeah, combine needling and moxibustion. For heat pattern, don't use moxibustion. Okay. Yeah. So I think we can stop here and have a break. 10 minutes. Okay. Please come back, please. So here is last point, which located in the abdomen. Okay, so last point located in the abdomen from stomach 19 to stomach 30. Okay, so this point named qi chong, rushing qi, right? Rushing qi. So it's a meeting point of stomach channel with the penetrating vessel and a point of sea of water and green. This point you can mark it at 1 star. 1 star. It's for some special symptom. We name that rushing pig qi. So rushing pig qi are viewed as disorder of penetrating vessel. So like the qi in the penetrating vessel, when they are rebelling, they create a symptom like that. Okay. So nowadays we don't have we don't have many opportunity to treat this rushing pig qi. Probably in the ancient time, for some reason, they're very difficult to explain that kind of symptoms. So the TCM have that term, rushing pig qi. Nowadays, it's very real, very real. How many points is stomach 29? Oh, what does that mean? How many points is? Okay. 2 star, yeah, 2 star, yeah. Stomach 30 is marked as 1 star, right? 1 star. Because there's special sign. Yeah. It has 1 chun inferior to stomach 29. That's right with the superior border of the pelvic symphysis. So like Ren 2, right? Ren 2, the level of Ren 2. Perpendicular insert 1 to 1.5 chun. Yeah. So in thin people avoid deep insertion, right? So secondly, same, ask a patient to empty their bladder before needling. And secondly, deep insertion in inferior direction in the male. Yeah, there is a structure there, spermatic cord, right? Spermatic cord. So be careful for that. Yeah, usually we do perpendicularly insertion, right? Yeah. For men, be careful to do inferior insertion. This one regulates qi in the lower jaw and regulates penetrating vessel and subdue rushing piglet qi. Okay, subdue rushing piglet qi. It's all about regulate qi, right? All about regulate qi. That's why it's named as qi chong, right? Rushing qi. So, especially for this, right? Subdue rushing pig qi. It treats hypogastric pain, sudden fullness, and the distension of the abdomen, fullness of the abdomen with inability to lie down, twisting pain of the abdomen, heat in the abdomen. So this is all the description of like Russian pig qi, Russian pig qi. Irregular menstruation, sudden amenorrhea, abdominal uterine bleeding. Yeah, it helps. It's like its neighbor, right? Stomach 29. Yeah, it has some same function as stomach 29 because it can regulate lower jiao qi. Yeah, include uterine qi, swelling and pain of external vagina, swelling and pain. It treat local area problem. Okay, local area, that's external genital area. Running piglet qi, right? Running piglet qi rushing upward to attack heart. Or photo, like fetal qi, right? Fetal qi rushing up to attack the heart, the mother's heart. Okay, so probably this part is a good one to study what is Russian pig qi, right? What is Russian pig qi? Let's look at this. Chong, its name is Russian qi or qi chong, right? Qi chong, or Polish qi. So connected with penetrating vessel because it's named as chong mai, So this point named as qi chong, right? Qi chong. So this name reflects both the ability of stomach 30 to regulate the circulation of qi in the lower abdomen. This is general qi, right? And it status at the point where the penetrating vessel emerge on the abdomen. So this point is location in the lower jiao are supposed to, visit one source, two branches, right? So one source that is qi and blood originate, in the lower abdomen. Let's say for women that's usual. For men that's somewhere between two kidney. So that is source of penetrating vessel and ren vessel. So the location of this point is kind of located in the starting point, origin of the penetrating vessel. So that's why it can treat penetrating. And also it's a point, meeting point of stomach channel with penetrating vessel as well, right? So it's kind of like good at to regulate penetrating qi. Okay, penetrating. So by regulate qi chong, this one can be used to disperse stagnation, pain, cold, and heat in the genital region, intestines, bladder, and the abdomen as a whole, right? And is indicated for such disorders as pain, fullness, and distension of the lower abdomen. Abdominal heat, twisting pain of the abdomen, heat in the large intestine, retention of urine and feces. So the lower situation due to qi stagnation. Okay, due to qi stagnation. When the penetrating vessel is diseased, there will be upsurging qi and acute abdominal disturbance. Yeah. So here is a description on the running piglet, right? Running piglet disorder arise from lower abdomen. It rushes up to the throat with such ferocity that the patient feels he is close to death. So because it's a sudden rushing qi, so the patient have a urgent sensation, right? Urgent sensation. Yeah.
Is it pain or is it more like acid reflux or is it vomit? Like what kind of surge are we talking about?
This is a qi rebellion. Not
qi rebellion. Okay.
Yeah, it's just a qi rebellion.
Okay.
It's kind of like suppressed from this Russian qi. Yeah.
So it comes out of nowhere. It just hits you and then it's.
It comes to you can consider about that's penetrating vessels issue. Right. Yeah. Okay. So it's just quickly rushed up and compress the chest and throat, so the patient feels is going to die. Yeah. Attack then remits. It's brought about by fear and fright. Yeah, because it's suddenly happened and rushing up. It caused some fear and fright. Yes.
So could it be considered more like a panic attack, like a panic?
That could be one of them.
Like if it's brought on by fear or fright, it's like a rushing of energy, like moving up to the chest.
Yeah, that could be. Okay. Yeah, we have the panic attack, right? Panic attack. That could be, with some qi rushing up and they suddenly feels like choke, right? With fear and fright. Yeah, okay. That's a good one. Thanks, Ben. Yeah, it could be, so but in the ancient time, people don't have that knowledge. They don't know that's a panic attacking. Yeah, they just name that Russian piglet qi, right? So when the penetrating vessel is diseased, there will be upsurging qi and acute abdominal disturbance. Yeah, so stomach 30 located on the lower abdomen and the point where the penetrating vessel emerges is the single most important point in the treatment of Russian piglet qi. Okay, so just remember this. That's kind of a unique part of this point. Yeah. So when you needle this point, it can quickly subdue this Russian qi, and that's very helpful to release this fear and fright. Yeah. Rushing piglet qi primarily arises when stagnant liver qi transforms to heat or when kidney yang deficiency leads to accumulation of cold in the lower jiao. Probably before it happening, there's some sign, right? There's some sign related to liver qi stagnation, transform to heat, or kidney yang deficiency. Stomach 30 is also indicated for like fatal qi rushing up to the heart. This condition described by this is a famous scholar Jin Yuan dynasty manifests its distension, fullness, and pain of the abdomen and heart in a pregnant woman. So I haven't expressed this kind of feeling. I don't know what's that. But maybe some pregnant women have that condition sometimes. Okay, so we'll say, yeah, for this is the important, like description about stomach 30. Okay. Next one, we'll go to the side, right side. So let's look at the video, see where it is.
Young men, stomach 21, is located on the abdomen, 2 cm lateral to the midline, and 4 cm superior. B1, stomach 31, is located on the upper thigh, in a depression just lateral to the sartorius muscle, at the junction of a vertical line drawn downward from the anterior superior iliac spine, and a horizontal line drawn level with the lower border of the pubic symphysis. The horizontal level may also be taken as approximately the most prominent point of the greater trochanter. Perpendicular or oblique insertion at 1 to 2 cm. B1, stomach 31, is located on the upper thigh, in a depression just lateral to the sartorius muscle, at the junction of a vertical line drawn downward from the anterior superior iliac spine, and a horizontal line drawn level with the lower border of the pubic symphysis. The horizontal level may also be taken as approximately the most prominent point of the greater trochanter. Perpendicular or oblique insertion at 1 to 2 cm.
Yeah, so this one, you can mark it 2-star, 1 or 2-star. Yeah, it's a good one for lower legs problem, hips problem. Okay. We have some points located around the hip. So this one is important because it's located in Yangming channel. Yangming have abundant qi and blood, and very helpful for B syndrome and atrophy, the muscle atrophy syndrome. So that makes this point is important, right? Because it's the only one located in hip. I mean, the stomach channel. You know how to locate it, right? So the easy way is ask patient to bend the hip a little bit and find the muscle. Okay, so this point is in the edge of the muscle, and then find the tip of great trochanter, right? That level. So that's the point. Yeah, so perpendicularly or obliquely insert 1 to 2 pretty deep, right? Pretty deep. Yeah, suppose they're under it, they're just muscle. Activate the channel and elevates pain, dispel the wind dampness from here. It kind of goes to new chapter, right? So nothing about lower abdomen, but focus on the limbs. Yeah, channels, meridians. So indication are atrophy disorder, painful obstruction of the lower limb, hemiplegia, numbness of legs, cold dampness, leg qi. Yeah, I talked about what is leg qi, right? Leg qi is kind of like some reason cause the leg swollen and cold. Swollen, usually from the feet, and developed into the calf, the knee, then even the thigh. Okay, from lower part develop into higher part. So that's like qi. Numbness, maybe swollen. Yeah. The pain of the hip joint, pain of the thigh, sciatica, contraction of the thigh muscles, cold pain for obstruction of the knee, inability to extend and bend the knee, lumbar pain, jaundice. Okay. For jaundice, seldom use it. It deals with jaundice because it can dispel the wind dampness. We mainly use it for, it's an important point to regulate circulation of qi and blood in the leg as a whole, right? And in the stomach channel in particular, right? So it said it's compared or corresponding to upper limb, like large intestine 15. Large intestine 15 is good for shoulder, right? So it's kind of mirror, right? The mirror for lower limbs is mirror. There's the hip, shoulder, hip, right? And stomach 31 is just beside the hip. Yeah, like the mirror point is Li15 in the upper limb. Its main application are in the treatment of, all kinds of Wei syndrome, B syndrome of the whole leg, right? Whole leg, or in the treatment of pain from the hip, right? Relating downward to the stomach channel. Pay attention to this chain and lock, right? Chain and lock. Usually it's paired with stomach 36 and stomach 41. So this one located in the hip, stomach 36, knee, and the stomach 41, where it is, it's ankle, right? Ankle. So chain and lock, choose points near to joints, and so connect them together, especially when there's a needle sensation, connect them together like the station by station, right? They pass the message station by station. And activity, the qi and blood in the channel treat the whole limbs issue, right? Whole limbs issue, paralysis, atrophy of the muscle, B syndrome of the lower limb. A number of classics also specifically recommend stomach 31 for cold pain or obstruction of the knee and for lumbar pain. Yeah, this is a good one for hip, local, and also benefit the whole limbs. Second is stomach 32, 腹突穴, right?
B1, stomach 31, is located on the upper thigh in a depression. Fu2, stomach 32, is located on the thigh on a line drawn between the lateral border of the patella and the anterior superior iliac spine in a depression 6th and proximal to the superior border of the patella. Divide the distance between the prominence of the greater trochanter and the upper border of the patella into thirds. This point is located just superior to the junction of the lower and middle thirds. Perpendicular or oblique insertion 1 to 2 cm.
Pay attention to palpitation, the how many chun there.
Fu2, stomach 32, is located on the thigh on a line drawn between the lateral border of the patella and the anterior superior iliac spine in a depression 6th and proximal to the superior border of the patella. Divide the distance between the prominence of the greater trochanter and the upper border of the patella into thirds. This point is located just superior to the junction of the lower and middle thirds. Perpendicular or oblique insertion 1 to 2 cm.
Okay. So basically it's a line with big one shape, right? Stomach 31 is on the same line, in the same line. Yeah. From prominence of great trochanter till the superior border of patella, that is totally 17 chun, right? 17. And this stomach 32, it's 6 chun above superior border of patella. Okay, 1 chun. So if we take the gap of the knee, right, the gap of the knee, that will be how many chun of them? 18, right? 18. So we measured from the superior border of patella, so that's 17. Then divide it into 3 equal portion. That one is a little bit, so 368. Okay, so that one because it's 17 chun, right? 17. So a little bit higher, right? 0.5 chun. I don't know, maybe how many chun? A little bit superior from the lower 1/3. Okay. Yeah, see, perpendicularly or obliquely insertion 1 to 2 chun. If you use it to treat knee problem, go obliquely towards the knee. Okay, go obliquely towards the knee. Otherwise, generally, in a general situation, we just perpendicularly needle it. Stomach 32. Let me look at this one. Big one, 2 star, Fu2, 1 star, right? Fu2, 1 star. Next one, Yin Shi, no star. Okay. So this is 1 star. The function of this one is similar with last one, stomach 31. It's activity channel elevates pain and dispel the wind dampness. Yeah, this is a good one for side problem. Okay, side problem. Muscles, spasm, muscle soreness of muscle, stiffness of muscle. Yeah, some person, they got IT band inflammation, right? IT band inflammation. So this is very helpful, stomach 32. So IT band inflammation manifested as tightness of the side, and this muscle usually starts stiffness. Okay, so needle, this one can help that. Indication, pain for obstruction, atrophy, disorder of lower limb, leg, chi pain, numbness, contraction of the muscle of the thigh, coldness, pain of the knee, weakness of the knee, lumbar pain, contraction of the arm. Yeah, but mainly just the muscles problem. Yeah. It helped some shine disorder, abdominal distension with diminished chi, disease of the 8 regions in women. This is in some classic books, right? Modern acupuncture, we seldom use stomach 32 to treat women's disorder. Next one is Yin Shi, stomach 32. Stomach 32. Basically, same line as the same line as stomach 32 and 31. And it's just 3 chun below stomach 32. Okay, 3 chun below 8. Yeah. Let's look at the video. We have time, so we can.
Fu2, stomach 32, is located on the thigh. Yin Shi, stomach 33, is located on the thigh on a line drawn between the lateral border of the patella and the anterior superior iliac spine in a depression 3 cm proximal to the superior border of the patella. 1. Locate Yin Shi, stomach 33, 1 handbreadth proximal to the upper border of the patella. 2. Locate Yin Shi, stomach 33, midway between Fu2, stomach 32, and the upper border of the patella. Perpendicular or oblique insertion 1 to 1.5 cm.
Yin Shi. So Yeah, probably, its function is covered by stomach 32. That's why it's not so important. Okay. And for knee problem, we have a lot of good choice, better choice than stomach 32. So, um, oh, sorry. I'm talking about stomach 33, right? For knee pain. Of course, you can choose it. It's helpful, but we have some better choice than this one. So that make it like no star, right? No star. So activity channel, elevates pain, dispel when dampness. Yeah, so treat side problem, knee problem. Um, yeah. Uh, so lack of strength in the leg, put stomach 33 and GB 39 together. Okay, so next one, 梁秋血, stomach 34, and mark it as at least 2 star. Okay, 2 stars. 梁秋血, it's a C-clap point of stomach channel. Okay, so this is the first thing you need to remember. Then from here, we go to specific points, right? Specific points of stomach channel. Stomach channel is a long channel. Okay, so from here, there are some specific points come out. Stomach 34, let's look at where it is.
Yin-Shi, stomach 33, is located on Yang-Qiu, stomach 34, is located on the thigh, on a line drawn between the lateral border of the patella and the anterior superior iliac spine, in a depression 2 Zun proximal to the superior border of the patella. Since the height of the patella is measured as 2 Zun, this point may be located 1 patella's length above its superior border. Perpendicular or oblique insertion 1 to 1.5 Zun.
Okay, that's a good way. Okay, so mirror patellar, then same distance above the superior edge of patellar. Because the patellar, the lengths of patellar are supposed to 2 Zun, exactly 2 Zun. So this one, stomach 34 is 1 Zun below stomach 33, right? Or we say 2 Zun above the superior edge of patellar. This one we do what? Like perpendicularly or obliquely insertion 1 to 1.5 Zun. Again, usually we do perpendicularly, right? If you use it to treat knee problem like arthritis, you do towards the knee. So its action, its activity, the channel, elevates pain. Okay, so like other points, right? Like its neighbor, right? But more focus on the knee, So harmonize the stomach and elevates pain. So this is because it's a C-clap point of stomach channel, and as a distal point, it's very effective to pacify stomach pain. Okay, especially when that pain is acute. So such as you eat some cold food and triggered the strong stomach pain. Yeah, needle 8. So stomach 34 kind of the first choice for that kind of situation. Moderate acute conditions, yeah, like acute pain, right? Acute pain. Or like vomit some blood, right? Vomit some blood. Yeah. Its indications is swelling and pain of the knee, difficult in flexing and extending the knee, pain of the knee and leg, creaneous pain. This is a crane's knee wind. What is crane knee wind? So this is another name of arthritis of knee. Okay, so the knee arthritis, if it's created by some, wind dampness, cold, so sometimes we name that, yeah, or not nowadays, but in the ancient time, in some classics, it named that situation as crane's knee wind. So, did you observe this bird, crane? So they have a huge knee, right? Swollen knee, not real swollen, but compared to their leg is thin and long, right? So they have a span. The leg seems like strong and thin, but their knee is just a big one, right? Big one. Kind of, like knee arthritis. Yeah, usually there is a swollen joint, right? Swollen joint. So this is an analogy, right? Analogy. So metaphor, right? Metaphor, but somehow it changed into a disease name in classics. We name that wind because the pain swollen, that's usually due to some exogenous, wind, cold dampness. Difficulty in working, painful obstruction, you name it. So any knee problem, right? Especially cold wind caused the B syndrome, arthritis. This is a good one. Yeah. And also treat epigastric pain, acid regurgitation, breast abscess. Breast abscess because stomach channel goes through breast, right? Goes through breast. Pain and swelling of breast or big fright. Later on, there is an explanation on what is big fright. Okay, so stomach 34 is the C-clap point of stomach channel, and it's only one for C-clap points of the 12 primary channel, which is located proximal to the knee or elbow. This one is the highest one, right? Highest one compared to the other C-clap points. It's an important adjacent point in the treatment of knee disorders. So because of stomach 34, stomach 33 seems like less important. Okay, so usually the stomach 34 cover the function of stomach 33 actually, if we use them to treat knee problem. So stomach 34 often combined with Xiyan, right? Xiyan. Xiyan is the eye of the knee, right? The lateral side of Xiyan is two, right? To inner side, the outside. Yeah. So the inner side is an extra point, right? Outside is stomach. Xiyan, 2B next one, stomach 35. Okay. So usually it's combined with this two and SP10 and SP9 and GB34. So this is a group to treat knee disorders. Yeah. And for painful obstruction, cold, and pain of the leg. Yeah. So the second point is general are indicated in the treatment of acute condition of pain. The yawning stomach channel, traverse breast and pass through the nipple, and it's classically indicated for such acute disorder of the breast, swelling and pain, abscess, right? In clinical practice, also used for acute epigastric pain. Yeah. Yeah. Remember this. It's an essential point for acute epigastric pain. You can combine this one with what? Just we studied Liang Wenxue, stomach 21. Okay, stomach 21 also moves stomach qi to treat stomach pain, food retention, any obstruction qi of stomach. So that is stomach 21 is a local point. This one is a distal point. Okay, combine them together. Yeah. So let's look at some breast abscess, right? So you can choose stomach 34 plus GB42 or stomach 18, right? Stomach 18. There is a contracted sinew with difficulty in flexation and extension of the knee, inability to work. That's stomach 34, there were 8, and Xiyang GB33. Those are like in classic book. Nowadays, we turn to use this. The modern acupuncture, we use this group. Okay, this group to deal with all kinds of knee problems. Let's stop here and have a break, 10 minutes. Okay. Okay, please come back. Let's study 2 more points. Then we were done today, okay? So look at the stomach 35.
Stomach 34 is located. 2B, stomach 35, is located on the knee in the hollow formed when the knee is flexed, immediately below the patella and lateral to the patellar ligament. This point is also known as lateral Shiyan, forming a pair with medial Shiyan, which lies immediately below the patella and medial to the patellar ligament, with the knee flexed and supported by a rolled pillow. 1. Perpendicular insertion directed towards Wei Zhong, bladder 40, 1 to 2 Tsun. 2. Oblique insertion in a medial and superior direction, behind the patella, 1 to 2 Tsun. 3. Behind the patellar ligament to join with medial Shiyan.
Okay, so this one we named that lateral Xiyan, right? Xiyan. So what is yan? Yanjing, you study pinyin yanjing, right? Yanjing meaning the eyes. So that's also, analogy, right? So if you bend the knee, so because there's a tendon prominent, so besides the tendon, it's like 2 depressions, like the eyes, 2 eyes. So stomach 35 is the lateral side eye. The other side is the extra point. We name that Xiyan, right? Xiyan. So it's kind of like there's 2 names for this point. One is 2B, the other is Y Xiyan. Y, right? Y compared to Nei, Y meaning outside. Okay, so what's the 2B meaning? Okay, so this is also very similar, like, nose of the cow, right? The nose, not cow, like, yeah, let's say cow. So, yeah, sometimes if you're trying to walk the cow, you have to penetrate in their nose and hide, string something, right? Then lead them to go forward. So it's kind of like the nose of the cow. Yeah, anyway, so both of them are very interesting, Xia or Dubi. Yeah. So this one, mark it at, since it's an essential point for knee pain, yeah, maybe 1 or 2 star. Yeah, 1 or 2 star. Calf nose, yeah. So needling, we have different ways, right? Just the video showed us. Yeah, you can from the outside towards inner side, right? Another side is Xiyan, or obliquely superior towards the inner side of patellar, right? Patellar, or it's towards Wei Zhongxue, like BL 40, right? Towards Wei Zhongxue. Yeah. So the depths will be 1 to 2 Chun. Okay, 1 to 2 Chun. Yeah. It's this pill when dampness reduce swelling, activate the channel, and alleviates pain, right? So it's all mainly about the knee problem, the legs problem, channels issue, right? Especially when there's a wind dampness, cause the knee is pain and the swelling. Okay, So swelling and pain of the knee joint, difficulty in flexion and extension of the knee, weakness of the knee, numbness of the knee, numbness of lower limbs, atrophy disorder lower limb, lag qi, etc., right? So it's a famous one for that. So in clinical practice, it's frequently combined with the extra point, medial xian, right? Medial xian, and then most often known as lateral xian, this one. Is an essential point in the treatment of all knee disorders. All knee disorders, yeah. Except for that, not too much to talk about for this point. Yeah. Okay, so next one is a shining star. Shining star. Okay, since it's for one of the command point. Yeah. So I would say, yeah. Some textbooks, some classics say, oh, well, this point can be used for treat any disorders. Any disorders. Let's look at this one. 足三里, right? 足三里. For new students, you probably not so.
Stomach 35 is located on the knee in the hollow formed. Susan Lee, stomach 36, is located below the knee, 3 chin inferior to Du B, stomach 35, 1 finger breadth lateral to the anterior crest of the tibia. 1. First locate Yang Yin Chen, gallbladder 34. Susan Lee, stomach 36, lies 1 chin inferior to Yang Yin Chen, gallbladder 34, and 1 finger breadth lateral to the anterior crest of the tibia. 2. Locate 1 hand breadth below Du B, stomach 35. Perpendicular insertion 1 to 1.5 cin.
Okay. Look at again, because like beginners sometimes confused, its location.
Susan Lee, stomach 36, is located below the knee, 3 chin inferior to Du B, stomach 35, 1 finger breadth lateral to the anterior crest of the tibia. 1. First locate Yang Yin Chen, gallbladder 34. Susan Lee, stomach 36, lies 1 chin inferior to Yang Yin Chen, gallbladder 34, and 1 finger breadth lateral to the anterior crest of the tibia. 2. Locate 1 hand breadth below Du B, stomach 35. Perpendicular insertion 1 to 1.5 cin.
Okay, this point, the easiest way is find the stomach 35, right? Stomach 35, and draw a line, goes down, then 3 trim distance, that will stomach 36, stomach 36. This is a big point, right? Big point. If you, a little bit deviate from it, still have a strong needle sensation, okay? But the best way is to locate it accurately. Then the patient got the needle sensation immediately, right? It's a very strong sensation immediately. Yeah. So needle edge, we need 1 to 1.5 trim. Okay. So that meaning choose a 40 millimeter needle. Okay, 40 millimeter needle. Don't just choose 1 trim needle and put in like half or one third. That's too shallow. So
Would you consider this a 3 or a 4-star?
Yeah, you can mark it 4-star, 5-star, whatever. That's
Whoa, it got the big 5. Okay.
That's the most important point in our body from our aspect. Okay. Yeah. So first, it's a Hersey and Earth point of stomach channel, right? And it's one of command point, which is a command point for abdomen. Okay, abdomen. And Ma Danyang marked it as one of the heavenly star point. And this is also called point of sea of water and green. Just now we studied stomach 30. You said that's also a point of sea of water and green. That one is the upper one. This one is a lower one. Okay, both of them are named as point of sea of water and green. However, the significance are different. Significance are different. So we name stomach 30. And this one is stomach 36. So this one we name that point of sea of water and green, mainly because its location. Okay, its location. In Neijing, let me answer the question. One most used point. Yes, it is. So in Neijing, it's described the passageway of stomach channel. It says stomach channel, let me use this picture here. Okay, it says stomach channel. Yeah, so from stomach 30 here, it's assembling all of the qi of blood of whole body. Okay, and through stomach 30, then it go deeper and nourish the organ, the whole body. Okay, so this is recorded in Neijing. That's why stomach 30 kind of a door, a gate of the yang yin channels, qi and blood, So it's getting in, and get out, right? Get in and get out. So that's why it's named as sea of, green and water, because it's assembling all of the qi and the blood of the yang yin channel and nourish whole body. However, stomach 36 named as lower, sea of water and green, that's actually stress its tonification function. Okay, tonification. So it's a key point, tonify qi and nourish blood and yin, and fosters the original qi. So as a sea, water and green, it's provide enough nutrition to our body, right? Enough nourishment. Yeah. Okay. So this one, let's look at the action, right? Harmonize the stomach, fortify spleen and resolve dampness, support correct qi. Correct qi is healthy qi, right? Healthy qi. And filters original qi. 25 qi, nourish blood and yin, right? So you seldom find a point which can, wear around and nourish the body, qi, blood, yin, yang, but stomach 36 can do all of them. It can revive the yang and restore consciousness even. Okay, so all aspects, right? Qi, blood, yin, yang. Also can clear fire and calm the spirit surprise, right? So usually if a point good at clear fire, clear heat, they don't normally in 25 body, right? But this one can do both sides. Yeah, clear fire, calm the spirit, also fortify the spleen stomach, foster original qi, 25 qi blood in, right? So it's amazing. Activity the channel, elevates pain, yeah, that makes it even better, right? So that meaning it can deal with channels issue, right? Sinews, muscles problem. Yeah, that's amazing. Revive the young and restore consciousness. It's kind of also save the life, right? So what do you think? How many stars is worth? It's kind of like, yeah, it's very good man. Okay, so a trait, first of all, it's a healthy point of stomach, right? Of course, as a distal points, it's harmonized stomach and 25 spleen and stomach. So if a gastric pain, nausea, so those full organs issue, right? Full organs issue. Then because it's also, harmonized spleen and stomach, it can treat some like diarrhea, like large intestine situation, right? Yeah. Then it to treat 5 taxation and 7 injuries. So in the commentary, that part explained what are they? Basically, you understand that those are due to overuse the body, right? Overuse the body and hurt the qi, yin, and blood, and create this situation here. Yeah. So obviously, it uses this function to 25 post heaven qi, right? And strengthen qi, blood, yin, and yang. And it treats dizziness, postpartum blood dizziness, dimeness, awakening, tinnitus, palpitation, hypertension, right? So it helps heart and liver to govern the blood, store the blood, and 25 blood. It treats some spiritual problem and mania, depression, manic thinning. Yeah. So it's named as a ghost. What I don't remember clearly. As a xie. Yeah. So ghost evil, right? Ghost evil is named as ghost evil. So it related to the spiritual issue, just like one of the stomach channel we studied in the abdomen, right? So because divergent channel of stomach goes to heart, some points located in stomach channel they deal with shen problem. Stomach 36 is one of it. Okay, so it's deal with shen and throat painful obstruction with inability to speak. Yeah, so some febrile disease creates some fire, right? So reduce stomach 36 can clear fire. Yeah, and those lockjaw, chronic spasm, loss of consciousness, yeah, can revival yang and wake up the shen. It's also to treat breast abscess, swelling of breast, painful of the knee and the shen, painful of the thigh and the shen, and wind stroke. Remember, we just talked about a cluster point, right? Cluster points. So upper is stomach 31, and middle is stomach 36, and lower is stomach 41. Yeah, so this is also very helpful for any lower limbs sinews problem. Yeah. Okay, so it's in the Ma Dan Yang's theory, one of the 11 heavenly star points. This group are most vital acupoint points indicated by for cold in the stomach, block rigors, diarrhea, swelling of leg, pain of the knee, initiation due to injury by cold, and all parasitic disorders. Yeah, and that's one of the famous commander points, right, for disorder of the abdomen, and even more. Yeah, one of the scholar in Song Dynasty declared that by using the point stomach 36, all disease can be treated. Okay, no matter excessive or deficiency, because you can use it clear fire. When you reduce it, you can also use it 25, right? When you 25 point. So this is kind of like, a very capable point.
Dr. Yan?
Yeah.
Quick question, just so I can see it. It's probably a stupid one, but I'm going to ask it anyways. Cold in the stomach, would that be considered like anorexic? Like anorexia? Not eating at all? I'm just trying to think of cold in the stomach, because I think if the stomach's too warm, then typically regurgitation and vomiting could happen. I'm just trying to think cold in the stomach. Would that mean like they're not eating in general, so loss of appetite or no appetite at all?
Oh, you think that's opposite way than a stomach heat?
Correct.
more
Or not
than
really?
that. Not
Okay.
really, not really. It's about appetite, but it's also about pain, right? And vomit,
okay.
nausea, those kind of. Because
Okay.
cold can block stomach qi, right? And
Yeah,
also,
that makes sense. Okay.
yeah, stomach qi can't descending. Yeah.
Yeah. Okay.
Like poor digestion, basically.
Yes, poor
Like the chi's
digestion.
not functioning correctly, so then it would
Talk about digestion, heat or cold, both of them can cause poor digestion.
cold. So I mean, like speaking of cold, like it's not digesting the food correctly. So you have like food in the stool and stuff like that. Whereas I think heat in the stomach would it be like more overactive digestion is digesting or
It depends. Like, yeah, it's cold. Yeah, definitely can cause a problem. You said that, yeah, like poor digestion. There's some food mixed with stew. That's because the stomach function, is jeopardized by cold, right? So basically, the organ, they rely on the organ's qi to do their functions. However, heat also jeopardize the function, also can block the qi. So heat, for example, like some yin deficiency, stomach yin deficiency cause the empty heat, right? So it's also maybe, like the digestion is not complete in that case.
Yeah, but if there is an issue with the stomach qi, not eating could also cause death as well. So if there's, so I'm kind of going my mind is like, well, if there's a deficiency of the stomach qi, in general, they may not digest the food properly. They could have constipation, loss of appetite. Like even currently, if anybody's constipated, the last thing they do is have an appetite, right? So I mean, it's common knowledge. So I guess my thoughts it's kind of a mix. If the stomach qi is not functioning, then either we're not absorbing the nutrients properly, or we're not eating at all to get enough nutrients. So that's kind of where my mind is going. But I mean, obviously. I'm thinking
that's reasonable. Yeah, I hear that. That's correct. You're in the right track. Yeah. Okay. So let's look at this more chat here. Heat sometimes means basic, cold means acid, depending on which again. Wait, suppose we use cold means acid. I would say no matter cold or heat pattern, both of them maybe there is an acid. Yeah, acid regurgitation, that's more likely in a heat pattern, right? In a heat pattern. Yeah. Cold mainly related to pain, strong pain. Okay, cold cause spasm of stomach muscle, and cold congealed vessels. Yeah.
That'd be because the chi is stagnating because of the cold, so it causes pain, right?
Yeah.
So I always remember the TCM saying where there's pain, there's stagnation. Where there's no pain, there's no stagnation.
That's part of the picture.
Well, I know like the there's a like that saying like because
how about damp heat?
Cold
Heat can block
also cause pain.
Yeah,
because of inflammation.
Heat also can block the qi.
Yeah.
Heat also can create obstruction, right? Yeah.
Okay. Yeah.
Don't worry, we'll get.
I'm trying to like.
We're always talking about that.
The puzzle, the pieces together.
Yeah. Now you're in that stage. Yeah.
I mean, we're at the end of the day, what we learned from like day one is there has to be a balance of everything in our system to run smoothly. So I think it's safe to say if anything is out of balance, it's going to create deficiencies or an abundance of something we don't need, right?
Yes, that's access.
Right.
Exactly. Yeah.
That's
the first step. You diagnose disorder.
Right.
Yeah. So I
love diagnosing it.
Okay. So or like the pathogenesis. Now you know that. Okay. Yeah. Okay. So let's continue to see this. The 足三里, right? Talking about the name, 乐一里, right? 里. We mentioned that in the pinyin class, right? So 里 is a unit to measure the distance, right? Measure the distance. So that, see, there's a very interesting description, interpretation here. I think that's very interesting. It said that stimulate stomach statistics would enable a person to walk a further 3 li. Li is kind of like miles, yeah, but not exactly equal to miles also, but it's shorter than 1 mile. But that interesting even when exhausted. so this is a kind of a will like stimulate qi in a we'll say like a very fast way, like encourage your healthy qi quickly. So see it's a function, revive yang, right? So revive the yang, restore consciousness, kind of let's use the word 肾上腺素 is adrenal. Adrenal. It's kind of
stomach 36 is located below the knee.
Sorry. You don't understand me. Seems like let me check my 肾上腺. Yeah, I'm talking about
adrenal gland. Oh, the adrenal gland. Yeah,
adrenal gland.
Adrenal gland.
So I'm trying to say this one. Seems like when you stimulate to this point, kind of stimulate adrenal gland, it has some similar effect. That's why it can awaken the shen, right? To do some life threat. Also can explain this phenomenon. Yeah, but this kind of metaphor. Okay, So this is also a famous one to help stomach 25 deal with all kinds of diarrhea. Okay, all kinds of diarrhea. So because it can fortify or like strengthen spleen and help to manage dampness. So in this way, it can, as a lower Hersey point. Is this a lower Hersey point? Yeah, it's a lower Hersey point of stomach for stomach. It's Hersey point. It's in the lower part, lower Hersey point. So yeah, so it used to treat counterflow qi and diarrhea. Counterflow qi of stomach, that's what vomit, nausea, right? That's counterflow qi. And diarrhea, so stomach 36 may be used in treatment of any disorder of stomach full, right? So that include acid regurgitation, right? So vomit, nausea, yeah, whether due to cold or heat, deficiency or excess stagnation and retention of food fluid or blood, right? So such as vomit, bleeding, choose it, right? Choose it. Any condition happening in its full organ, the stomach, you can use it. So as the Earth's point of stomach channel also has profound effect on regulate its coupled Earth down the spleen, right? And is able to strengthen the spleen's function of transforming and transporting both food essence and fluid. Okay, so that will produce two effects, right? One is, to promote spleen, produce more qi blood essence to nourish body. Another effect is help manage dampness, right? Help manage dampness, remove this retention of dampness. Yeah, so to treat diarrhea, right? Diarrhea, yeah. It should be emphasized that ability of stomach 36 to transform dampness derived from its primary action of 25 spleen, right? So stomach 36 is not a point like spleen 9 directly manage dampness, no. So it's through the function to strengthen transportation and transformation of spleen indirectly to transform dampness, okay? Yeah. It's a very general statement. I think it plus more it implies more code type of difference disorder. Okay, so you guys discuss something. If you want me to explain, you can speak it out. Okay, so this is the talking about also, give us a clue, right? When there's edema, there's a large amount of fluid retention, why we don't choose stomach 36. Yeah, because it's not like spleen 9 can deal with the water directly. It said that even in severe disease, strong stomach qi is encouraging prognostic sign, while in a less severe disease, exhaustion of stomach qi is a poor prognostic sign. Okay, so here is talking about stomach spleen, how they are important to manage the post-heaven qi. We say that the kidney control the pre-heaven qi, right? Stomach spleen control the post-heaven qi. Yeah, so that's true. That's a description in TCM classics, and I think I agree with it very much. I agree with it. Yeah. So when you treat some difficult, tricky case, if the patient's stomach qi is strong, still good, usually the prognostic sign, prognosis is good. Is good. If in the opposite way, that's bad. That's bad. Okay. No matter what kind of disorder, what kind of problem, if stomach qi is very important. Yeah. So stomach 36 is given as the lower point of sea of water and green. I talk about that, right? Yeah. According to this passage, when the sea of water and green is in excess, there's abdominal fullness, and when it's deficiency, there is a hunger with inability to eat. There's a hunger with inability to eat. Okay, so stomach 36 is the single most important point in the body to stimulate the action of stomach and spleen in generate qi and blood. So we studied the group of 25 qi, the group of 25 blood. So in both group, stomach 36 is the essential one, right? Essential one. Yeah, that's the reason. And also stomach 36 is also renowned for its ability to support correct qi. A healthy qi is kind of talking about our immune system, right? Our ability to resist the evils. So there is an ancient way, mox and bastion on stomach 36, even for healthy people, it can strengthen the immune system, especially for weak people, vulnerable people. Yeah, if you keep doing mox and bastion on stomach 36, are supposed to strengthen healthy qi, right? Healthy qi. Yeah, here in this paragraph is talking about what is 5 taxations and 7 injuries. You can read them after class. And the stomach 36 also indicate classically for insufficiency of both original qi and yin, right? Qi and yin. So this is a unique one, right? Usually if a point 25 yang, they want 25 yin. If they 25 yin, they want 25 qi or yang. But this point can do both. Yeah. And next paragraph is talking about how stomach 36 treat a wide variety of mental disturbance. So from all aspects, it's talking about clear fire and for different qi deficiency, blood deficiency can nourish Shen, which stomach 36 can 25 blood to control Shen. Yeah, and also it's one of the ghost point, right? So then spin 36, stomach 36 also can manage dampness and flame, right? Like stomach 40, yeah, they can go together, can calm down the Shen and treat some Shen problem. Stomach 36 is an important point to treat disorder of stomach channel, including swelling, pain, and abscess of breast, as well pain of side and shin and knee. It's a good one for sinew, right? Sinews, lower limbs. Yeah. So it's mentioned that again, right? Stomach 36 paired with stomach 31 and then stomach 41. Yeah, to deal with the whole limbs problem. Furthermore, stomach 36 can treat the collapse of yang, characterized by loss of consciousness or in cold counterflow of limbs, purplish lips, right? So for example, if a person falling in the water, right? So, and loss of consciousness. Yeah. So someone saved the person. Okay. So probably stomach 36, do 26. Yeah.
So this would be good for hypothermia?
What is hyperthermia?
Hypothermia is when there's a decrease in your body temperature. So that would cause purple lips.
Oh, okay.
Yeah.
Yeah. Like low temperature syndrome.
Yes. Yeah.